Stop the record. So apparently many of you have been lifing and have no idea what new health policies exist, especially when it comes to maternal health care. We're not here to tell you who to vote for. That is your own prerogative. Okay, Bobby. However, what we are here to do is to make sure that you are an informed voter. What does that mean? It means that you're aware what new health policies exist, what health policies are yet to come, and what health policies got passed over. Yeah, there are a couple of them, and we need to talk about it. Hey, you guys, thank you for joining us. Don't stay on the sidelines of maternal health policies. Stay in the know. Make sure that you check out this episode. Consider it your Cliff Notes on maternal health policies. Thank you for joining us, and don't forget to click subscribe. What we're also here to do is to make sure that we don't undermine the work of when it comes to Black women in the US, right? So oftentimes the things that we do, our accomplishments get undermined because of undermining racism in this country. We're not going to do that. You may not necessarily agree with her health policy, but we're going to talk about what Vice President Harris has actually done. Because a lot of y'all in these social media streets are saying she do nothing. And yet her record shows quite the opposite. Some of them you may agree with, some health policies you may disagree with, but what we're not going to do is say that she hasn't done anything. Okay. So let's talk about the current state of healthcare. Well, as we all know, still maternal health is a crisis in the United States. This is not a secret. We all know the stats, and the stats have not improved. In matter of fact, in some sense, the stats have actually gotten worse. But there may be some contributing factors like the pandemic that may have contributed to that to some degree when it comes to the disparity of treatment and diagnosis and care during the pandemic and the spread of the actual disease. But we can't keep blaming the pandemic forever. At some point, we have got to make changes when it comes to maternal health care. So what a lot of people are saying is that what has Vice President Harris actually done? And granted, we haven't really heard this question when it comes to vice presidents in general, but here we are. So we're going to try to answer some of your questions when it comes to what has she done. But the first thing we want to do is kind of get a better sense of her history when it comes to what issues are of priority to her. So some of you may not be aware, but fibroid research has actually been a priority for the VP and current presidency candidate. So fibroid research, as we know, fibroids are the number one cause of when it comes to gynecological surgeries in the US. So it affects all generations, all ethnic groups, all races, right? And again, race is a social construct, but we're going to refer to it because that's how a lot of research categorize people who are participants in the research study. So that being said, because we know it also disproportionately affects Black women, but yet the number of research and really good research projects and studies that are targeting either treatment or understanding why we develop fibroids has been subpar. And so one of the things that Vice President Harris has done is she has actually been a huge advocate for increasing the amount of funding that goes into research towards fibroids. And that's oftentimes the underlying issue. Not that there aren't ideas out there, because a lot of us have ideas, but it's about the funding. If you have ideas and no funding, your research goes nowhere. And so that it's good that she's realized that when we talk about gaps in healthcare, sometimes it's about funding gaps. And so she has reached out and has made it a priority to increase funding in this specific area. And so in 2020, our current Vice President Harris introduced a bill to Congress called the Fibroid Research and Education Act. Now, let's talk about maternal health care. So one of the things that has been very much consistent with Vice President Harris's stand is actually looking at maternal health care. And it's no surprise that throughout the current Biden-Harris administration that there are several bills and executive orders that actually target improving maternal health care. So let's talk about that some more. So in addition to other congressmen and women, there has been a very intentional focus on maternal health care. Why? Because as we mentioned, it is still a crisis in the United States. We are still the last when it comes to maternal health care amongst developed nations. And that is no Olympic gold. So, one of such efforts has been the Momnibus Act, and it was initially introduced in 2020 and then reintroduced to Congress in 2021. So, the Momnibus Act is a list of separate bills that are geared towards improving maternal health care. And so the act has included such things as addressing social determinants that have a direct impact on maternal health care, increasing the eligibility to WIC throughout the postpartum period, increasing a diversified birth workers force, and improving maternal health when it comes to veterans. That is an area most of us are not talking about, and it really needs a lot of attention because the care that our veterans are getting is really embarrassing for such a technologically, industrially advanced nation. But nonetheless, it is also on the list. And also just even supporting community-based organizations like Healthy Bum Club that are doing the work when it comes to maternal health care. So that is the Momnibus Act. And Vice President Harris has been a supporter of this act. The one of the other things that she has been very proactive and actually instrumental in doing is also extending the postpartum coverage of Medicaid. So more than 65% of Black women who give birth under being insured under Medicaid. One of the challenges has been that we have arbitrarily cut off the postpartum care and services just a few months after birth, where we know the impact of childbirth can last several months up to a year. In fact, some people argue even longer than that. From a physiological standpoint, with the presence of hormones that exist in the body for that long and even further. From the mental health standpoint, knowing that women who have experienced mood disorders as a result of pregnancy and pregnancy experiences can experience those mental health disorders for up to a year, and some would even argue even longer than that, based on their personal experiences. So there was clearly a need to extend the postpartum care, and also keep in mind that when we look at the rates of maternal mortality, the highest rate of maternal mortality occurs during the postpartum period. And so there's definitely been an identified gap in care when it comes to postpartum care. And so I, for one, was excited to see the extension of postpartum services under Medicaid extended to a year after childbirth. And this has now been adopted to some degree by 46 states, which is fantastic. One of the other very instrumental changes in health policies that has occurred, as I mentioned, maternal mood disorders, perinatal mood disorders, not just occurring postpartum, but also recognizing those who experience depression and anxiety during the pregnancy itself. Is very important. And why is this important? When you look at the top causes of maternal mortality in the United States, guess what's number one? You got it. Number one is mental health issues, correlating both not just mood disorders and subsequent issues, but also substance abuse. So we have overlooked the impact of substance abuse on maternal health outcomes, and that is changing by all of these policies. So there's been a very intentional focus on supporting moms who have substance abuse issues so that they're less likely to have these adverse outcomes. But nonetheless, one of the most important changes that we all need to be aware of is, for the very first time, there is a maternal mental health hotline in the United States. You heard it. There is a maternal mental health hotline now that exists for all who are struggling with maternal mental health issues to be able to reach out 24/7. Now, why is this even more important? For many of us who are in the healthcare space, and for many who have been affected by mental health disorders during pregnancy, we know there is a devastating shortage of services and psychotherapists to be able to address some of these issues. Social workers are basically overwhelmed by the numbers of mental health disorders, especially after the pandemic. And so there has been wait lists waiting for psychiatrists, waiting for a therapist, where people aren't getting timely care when it comes to maternal mental health. So this is potentially a game changer. Also, not addressing people who are in acute crisis, but also giving people resources to be able to tap into if they haven't received the care that they're looking for. And so, what's important for you to know about this hotline? It's important for you to know, one, that it's a national maternal mental health hotline. So, you don't have to necessarily be enrolled in any other services. This is national, it's confidential, it's free, and the goal of the hotline is to help women and their families to address mental health issues before, during, and after pregnancy. And the hotline number, important for you to know, is 1-833 TLC Mama. Again, that's 1-833 TLC Mama, MAMA. And that number, for those who don't want to go through the trouble of figuring out what the letters represent, is 1-833-852-6262. Again, that's 1-833-852-6262. So go ahead, if you're having mental health issues or concerned about someone who does, go ahead and give them a ring. One of the other policies that has been so critical, and there, you guys, I'm not going over all the policies because there's a long list. So other things that I'm not going to go into detail about, but you should be aware of, is the fact that there are now guidelines for hospitals to be considered to even be able to care for patients who have mental health disorders, to care for women who are pregnant in general. So there are now requirements for hospital to meet. So basically creating a standard. And now there is, for the very first time, a designation that is a birthing friendly hospital. So in order to be a birthing friendly hospital, you have to meet certain criteria. And now that designation is searchable by all moms everywhere. There is also now nursing our newborn kits that are being distributed. There are services supporting community organizations. There are also services supporting the increase of mental health services. And one of the most important things that we have talked about, but clearly not enough on this platform, is the disparity when it comes to maternal health outcomes. So we know that Black women, as well as Native American women and Pacific Islanders, have some of the worst outcomes when it comes to maternal health. And let's not forget those who are giving birth in rural areas. And we know that a lot of rural areas are now considered to be maternity deserts. And so there's a lot more funding going into improving the services in those areas. I'm not going to the details about that. You guys can look a lot of this stuff up, is very much accessible, but I just want to point out some very critical areas that we as women of color should really be paying attention to. So how about the fact that we now have a Black Maternal Health Week? Okay, that's a big deal. Now, what it says to the entire, not just nation, but the world, that we recognize that there is a disparity when it comes to maternal health outcomes. And so by now designating a week in April from the 11th to the 17th and signing in as an official decree that that is Black Maternal Health Week, it doesn't just put more attention on the issue, which is also very critical and important, because a lot of people still don't seem to understand how our current maternal health care disproportionately affect Black women. But it also causes people to intentionally put resources into focusing on this issue, and that's a big deal. So it's one thing to acknowledge and to have, hashtag Black maternal health care, but it's another thing to actually intentionally do some type of effort during that week or in preparation for that week that actually makes a difference when it comes to these despairing outcomes. So you guys, this was just a snapshot, and I do mean a snapshot because the list goes on. They've done things like improving pipes in air in communities that are at risk for lead poisoning, and there's just the list goes on. And so I hope this brings some clarity and improve our understanding that there are policies, health policies, that should garner a lot of our attention. There's efforts also to improve our diversity of birth workers, such as midwives and doulas, and improve the involvement of midwives and doulas into our healthcare system and integrate them, and improving our utilization of birth centers, funding in so many different critical areas to really address this maternal mortality crisis that exists in the United States. So, I hope this gives you some light. And some of you may not agree with these health policies or agree with the spending in these areas. That is not our prerogative. That is your prerogative. Our goal is just to make sure that when we're making these decisions and making these comments, that we're actually informed public citizens, right? That we are actively participating in our own economics and in our own healthcare policies, that we're aware of what's going on, what decisions affect our own healthcare, like the cap on spending when it comes to certain medications like insulin, which we know diabetes disproportionately affect our communities. So let's put a lot of these things together and sort of say, oh, okay, I see that policy there. It seems to be a general policy, but does it in any way disproportionately improve my health, or doesn't improve, or doesn't address my health at all? So it's really important that we are able to analyze these health policies and see how they affect us, our family members, so that we can, when we go to those polls, and I hope we are going to those polls, because it's important that we use those rights that was purchased with blood. Okay, this is not a free right that we acquired. This was purchased with blood. So looking back on our civil rights leaders and their vision for the country and how they had to endure the lack of all of these policies. There were no policies protecting their health, yet they had the vision that they felt that had they had the vote, that they would be able to make changes. So let's make sure that we utilize that vote and that right to be able to vote for our representatives, not just on a national level, because we're very reactionary in this country, looking at the national elections and not paying attention to local elections, which then determines what happens nationally. Let's connect those dots, you guys. So let's be proactive in our participation as citizens in the United States of America. And one more thing we're going to say, go team. So we are cheering on our Olympic star, Allison Felix, who has been not just an incredible Olympian, but also she has been just a tremendous advocate for maternal health outcomes. And as she has experienced preeclampsia herself, she has been a huge advocate in sharing and spreading education on preeclampsia, especially in the Black community, and the use of low-dose aspirin in prevention of preeclampsia. But even more importantly, now that we're in the Olympic season, it's important to know that she has just done such incredible work when it comes to maternal health, especially that affects the Black community, that she was awarded, you guys, listen to this. She was awarded, you guys, $20 million, okay? $20 million to target Black maternal health as part of a grant that was granted to her by philanthropist Melinda Gates, as a part of a $1 billion effort to help women and girls globally. So I'm so excited for this, you guys. And what is she already doing? Y'all, listen to this. On these Olympic stages right now, she has already established a nursery for our Olympians. That, listen, game changer. Drop the mic. Drop the mic. So we are so proud of Allison Felix and her work, and that she's literally changing the game. Okay, she's changing the Olympic game and allowing moms to be better supported, including their breastfeeding moms. I know you guys have seen the video of some of our Olympians who are able to be in this nursery breastfeeding, which, can we just talk about how incredible that is, that they're able to breastfeed and undergo such rigorous physical activity and preparation, training, and performance? That's a whole other topic. We don't even have time to go there, but we just want to shout out the work that she is doing to make sure we're all aware of all these moving pieces that are going on that are geared towards improving not just Black maternal health care, but in general, maternal health care when it comes to our Olympians, when it comes to our veterans. There's a lot going on, you guys. So make sure you pay attention. And one way you can pay attention is by tuning in right here. This is Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube, and the hand behind the handle of Healthy Bump Club on Instagram. And guess what, you guys? We are now on Fanbase. Yes, so you can find us also at Healthy Bump Club on Fanbase. And we hope to see you on one of those platforms as we continue to extend our reach in this virtual world, as we educate, inform, and empower you when it comes to maternal health care. We see you guys when? Next episode. And a special shout out to our miserable, happy cat ladies out there.